Hello and welcome everyone. Myself Mijanur Rahaman, and today my topic of discussion is attachment to the radius. So today we will discuss about the attachments to the radius. Now in this video we will try to discuss what are the attachments that is present in the bone, that is radius. In the previous video we have discussed about the morphological features of the radius. Now we will try to discuss about the attachment of the radius. So first of all, attachment of the ligaments. In case of apparent, there are four ligaments present. One is annular ligament, number two is quadrate ligament, number three is capsular ligament, and number four is radial collateral or lateral ligament. So annular ligament, it is attached to the articular surface circumference of the to the head of the radius. So annular ligament, it is the attached to the articular circumference to the head of the radius. And the second, the quadrate ligament, that is extended up to the neck. Capsular ligament and the radial collateral ligament. So these are the ligament that is present in the upper end. Okay. And there is one point that you can remember, that is synovial membrane and the capsular ligament are common in synovial joint. This is an important point you can remember. So what we have discussed till now? We have discussed about the attachment to the ligaments, and in upper end there is four ligament: annular ligament, quadrate ligament, capsular ligament, and radial collateral or lateral ligament. And in case of annular ligament, it is attached to the articular circumference to the head of the radius, and quadrate ligament, it is extended up to the neck. And the synovial membrane and capsular ligament are common in synovial joint. Now attachment to the body or shaft. Now number one, that is to the radial tuberosity. And in the radial tuberosity there are two parts. One is rough part and one is smooth part. So in case of rough part, it is the site for the attachment of biceps brachii. And biceps brachii is the main flexor muscle. In upper extremity. And the smooth part it is for the attachment of bursa, which acts as buffer to avoid friction. Now to the anterior surface. in the upper 3/4 there is supinator muscle, and in the lower 1/4 there is brachialis. Now, in case of intersurface, there is in upper 3/4 there is supinator, and in the lower 1/4 there is brachialis. And it is in the brachialis, it is the most strongest flexor muscle. Okay, strongest flexor group muscle. Now, as its upper part, flexor digitorum superficialis, and as its lower part, pronator quadratus. Now we will know that how the muscle are named. Muscle naming. So if you take the name flexor digitorum superficialis, then the flexor that denote the movement flexion, so it is a movement name. Then the digitorum, which is related to digits, which is termination point or end point. Then superficialis, which is related to superficial, which is the position of muscle. So this is how the muscles are named. Now we will try to discuss about the attachment to lateral surface. Now in the lateral surface there is extensor carpi radialis longus, which is the longer muscle, and number 2 is extensor carpi radialis brevis, which is smaller than the extensor carpi radialis longus. It is comparatively smaller. Now at the lower point there is pronator teres, and at the upper part of the styloid process there is brachioradialis. Now we will discuss about the tooth posterior surface. Extensor carpi radialis longus, extensor carpi radialis brevis, then the extensor digitorum profundus. And profundus means more volume. So what we have discussed in this video, the attachment to the ligaments in the upper end, in the body or shaft, in the lateral surface, medial surface, those surfaces we have also discussed. And we have if we now discuss the bony attachment. If we take this bone as radius and this as ulna and this as the humerus, then there the first joint comes in case of radius, that is radial joint or radiohumeral joint, and this joint is formed between the capitulum of humerus and head of the radius. Now here the superficial or superior radioulnar joint. This is formed between the radius and ulna. And it is the head of the radius and ulna. Now this is the middle radioulnar joint. Now it's a first point, that is it is not a bony attachment. It is a membranous joint. And this joint is formed by the interosseous membrane. This is the radius bone, this is the ulnar bone, and these both are interosseous border, and in between the interosseous border there is a membrane present. This is known as interosseous membrane, and the interosseous membrane joins the radius and ulna. That's why it is known as middle radioulnar joint. And in the lower part there are 5 surfaces. We know that there is this is inferior surface, this is anterior surface, in the behind posterior surface, this is lateral surface, and this is medial surface. So here the joint forms, that is inferior radioulnar joint. And inferior radioulnar joint, it is formed by here is a notch present. This notch and the head of the ulna togetherly form the inferior radioulnar joint. And in the lower part, here the carpal joint we will draw here. This is radius bone, and in the radius bone, here you can see that there are 2 parts. One is for scaphoid, the quadrangular scaphoid, and the triangular lunate bone. These are carpal bones. And here the formation of joint which is known as radiocarpal joint. So these are the joint which are formed. Now there are also some another point, like we will discuss about the elbow joint. And this carpal point joint, radiocarpal joint, is also known as wrist joint. So in case of wrist joint formation, there is only the participation of radius bone and carpal bone. Here ulna is not attached. So what are the members of wrist joint? That is radius, scaphoid, and lunate. These are the three members of wrist joint. And in case of elbow joint is formed by three joints. Number one, humeroradial joint. Humeroulnar joint and superior radioulnar joint. This is humerus, this is radius, and this is ulna. So this one this one humeroradial joint, this one humerulnar joint, and this one superior radial joint. These three joint togetherly form the elbow joint. And when the elbow joint is formed, there is one fossa is present, or deep impression is present. That is fossa is present. That is known as cubital fossa. We have also discussed video or related more comparatively described video or dedicated video about the cubital fossa. You can also watch that to know more about the cubital fossa and their related structures. So what we have discussed in this video till now. So in the first point we have discussed about the attachment to the radius, and in the attachment we have discussed about the first point, that is attachment of the ligaments. And in case of upper end, there are four ligaments. One is annular ligament, quadratus ligament, capsular ligament, lateral ligament, or radial collateral ligament. Annular ligament is attached to the articular circumference to the head of the radius, and quadratus ligament is extended up to the neck. Now an important point, that is synovial membrane and capsular ligament are common in synovial joint. Whenever you found any synovial joint, there you can also found the synovial membrane and the capsular ligament. Now attachment to the body or shaft. Number one, to the radial tuberosity. We all know that radial tuberosity has two parts. One is rough part and one is smooth part. In the rough part, there is the attachment of biceps brachii muscle, which is the main flexor group of muscle in the upper extremity. Then the smooth part, there is the attachment of bursa, which acts as a buffer to avoid the friction. Now to the anterior surface. In the anterior surface, upper 3/4 has pronator and lower 1/4 has brachialis, which is the strongest flexor group of muscle. And as its upper part has flexor digitorum superficialis, and as its lower part has pronator quadratus. And now we have discussed about the muscle naming, how the muscle nomenclature is occurred. So if you take an example of flexor digitorum superficialis, the flexor comes from the term flexion, which is the movement name. Then the digitorum, which comes from the digit, that is the termination or end point. Then superficialis, which is related to superficial, it is the position of muscle. Now attachment to the lateral surface. Number one is extensor carpi radialis longus and extensor carpi radialis brevis. Longus one is the more longer muscle, and brevis is comparatively smaller than the longus. Now at the lower point there is pronator teres, and upper part of the styloid process has brachioradialis. Now to the posterior surface, number one extensor carpi radialis longus, number two extensor carpi radialis brevis, number three extensor digitorum profundus. Profundus means more volume. Now we have discussed about the bony attachment of the radius. There is the humeroradial joint, superior radial ulnar joint, medial radial ulnar joint, inferior radial ulnar joint, wrist joint. Now, humeroradial joint, there is capitulum of the humerus and the head of the radius. The superior radial ulnar joint, the radius and the ulna, which together form the joint. Then medial radial ulnar joint, it is not an bony attachment, it is a membranous joint which is formed by the radius and ulna, and it is in this between the membrane is known as interosseous membrane, which is present between the interosseous borders of the each bone. Now, inferior radial ulnar joint, that is present in the inferior part, and the elbow joint, we have discussed the humeroradial joint, humeral ulnar joint, and superior radial ulnar joint togetherly form the elbow joint, and the radiocarpal joint or wrist joint, which is formed by the radius and the carpal bones. This is the joint which help to make the wrist joint. There is three bone, one is radius, scaphoid, and lunate. And in this one, ulna has no and any type of any attachment. So this is our today's topic. Today we have completed an important bone, that is radius. So if you have any query or any doubt, you can comment down in the comment section, and please comment down if you have any query or any doubt. And thank you so much for watching the entire video. Do like, share, subscribe to my channel, for supporting me and my channel. Thank you so much for watching.